was really fantastic, and we thank Dr. Curl, who's going to run do her work on her other population, the ravens, her second job. So now it's my pleasure to introduce to you Shree Pandya. Shree and I also have been colleagues for a number of years. I was trying to figure out exactly, and I think 12. But Shree began as a physical therapist. She, in India, she actually didn't know, said in an interview for an award that she won from the Foundation for Physical Therapy, she said, didn't know much about it. At first I thought I might want to become a neurosurgeon, but I decided not to. Went into physical therapy school and never have had a minute's regret. It's the best decision I've made in my life. She moved to the United States in 1973, received a Master's of Science from University of Wisconsin-Madison, and then moved to the University of Rochester, where she's been a clinician, researcher, and educator for the past 30 years. She holds a faculty appointment in the Department of Neurology in the University of Rochester. And what's really extraordinary about Shree is not only her expertise in physical therapy, which has helped shape recommendations for many different patient groups, including FSH. You may have seen the Physical Therapy and FSH pamphlet that she wrote with Wendy King that is available on the FSH website. Yes, it is. But she has been a major player in the development of clinical trials in muscular dystrophy. So the early trials in Duchenne muscular dystrophy, in the training of clinical evaluators throughout the years, in shaping clinical trials in muscular dystrophy. And this is so incredibly important to us that, for instance, one can have a good drug, have a bad trial, and not find the signal, not find the positive, and to move the drug forward. So the field is really greatly indebted to Shree. And I am personally, I will never forget when I was a very young faculty member starting off in muscular dystrophy. I had about an hour-long ride in someplace in upper New York, in the Goonies, in which she really displayed her passion for muscular dystrophy and encouragement to me. And so we're really happy to have you here.
So I really want to thank the FSH Society and Dr. Wagner for having me here this morning. And thank you all to those that are here and that are watching online. I'm going to try and keep this fairly informal. I do have my set of slides and we'll go through that, but then really what this is all about is trying to answer your questions. So I want to make sure that we devote enough time for that. As Dr. Wagner mentioned, I've been involved with muscular dystrophy for a long time, and actually FSH a lot since the 1990s. When at the University of Rochester, we first started doing our natural history studies in preparation for clinical trials, and we continue to pursue that. I'm just curious, how many of you are familiar with what goes on at the UFR, or how many of you know about the registry which is located? A couple of people, wonderful. And so I would encourage you to spread the word and get others involved in the registry, because sometimes randomized controlled trials, yes, they are the gold standard, but they become difficult to do and very expensive to do. But if we can gather a lot of good information through the registry, that's also another way to learn a lot of things. And so it's important for us that folks are involved in the registry and give us the information, updated information every year. So thank you to those who are in the registry, and please encourage others to join up. So Dr. Wagner showed you the guide, and actually one of the reasons that the FSH Society asked us to do the guide was because we Wendy King is located at Ohio, and she's been involved in muscular dystrophy for a long time also. And as we were doing the natural history study in the 1990s, we saw a lot of patients over that 3-year period. And we heard so many stories about, how they went to a physical therapist, and the physical therapist had no clue what FSH dystrophy was, and they made them do this and that and whatever, and it was worse after that, and what really should we be doing? And I understand the problem. It's like even with a neurologist, the muscular dystrophies are rare conditions, and it's not often that neurologists or physical therapists come across these conditions. You may be the one and only person that they see in their practice. And it's only the specialized centers, the neuromuscular disease centers, where you have a team of specialists who are working with the muscular dystrophies, really know the condition, keep up with the literature, and have the experience from having seen so many patients that they can really make the appropriate recommendations to you. And that is, again, not to say that the others aren't interested in helping. It's just that that's not the practice. If you think of neurologic conditions, stroke, Parkinson's, MS are more common. Same in physical therapy. People are working with stroke, Parkinson's, MS in children with CP, spina bifida, child with muscular dystrophy is uncommon. So it's not unusual for people to not know these conditions. And one of the reasons for the guide was actually to help both physical therapists and patients to know the condition and to help develop an individualized plan of care based on the best research evidence, clinician experience, and patient preferences. And I really want to emphasize those last two because, again, there's not much research evidence in everything we recommend. Randomized controlled trials are the gold standard. Randomized controlled trials are few and far between. And even when they exist, they are being done with a small number of patients when it's related to exercise, or they're not of a long enough duration. This is a long lifetime condition. No trial goes for even 3 years, right? Most trials go to 12 weeks, if you're lucky, 6 months. And so you really need to extrapolate whatever you learn from those shorter duration trials and make lifelong recommendations. And this is why I said to you, the registry data for us, now that we have registry data from people for over 5, 7, 10 years, we are learning a lot. And just recently, Dr. Statlin at our site has started publishing data from that information, which I think is going to be very useful. So for those of you that may have not seen the guide on the website, I would urge you to take a look at it. Most of the information in the guide is still very pertinent. I would recommend that you review and share it with a physical therapist if you're going to go to one, so that you're all on the same page about what this condition is and what the current recommendations are in terms of exercise, activities, orthotics, etc. And really make as much use of it as you can. What I'm going to do today, though, is basically discuss some of the pertinent information from the guide, but then also provide additional updated information based on the literature since the guide was published and where we are at now. So as physical therapists or rehab professionals, when we think of health, I at least tend to use the definition of the World Health Organization. And it's interesting because this definition came out before I was born, but I think it's still very pertinent. And to me, as a clinician, health is a state of complete physical, mental, and social well-being. When I work with a patient, it's not only about their physical activities, but it is about their quality of life. How are they functioning? Are they able to fully be part of whatever role they have as a parent, as a sibling, as an aunt, as an uncle, as a grandparent. Are they able to really do the things in life that are important to them? And how can I help them do that? So to me, and I think most physical therapists and rehab professionals, we take this holistic approach and think of physical therapy in those terms, and how can we help the mental and social well-being, not just the physical well-being of our patients. And so the goals of physical therapy, as I see them, are to help maintain optimum health and wellness. We know that because of your dystrophy, there's a certain amount of disuse. If you can't use your arms all the way, it's quite likely that you stop doing certain things. And that has because of the weakness in your scapular muscles and not doing things, that's going to affect your deltoids. Even though they're not affected by the dystrophy, it may affect the distal muscles because you're not using your arms as much. And so if nothing else, we want to try and prevent and delay the disuse weakness, as it is called, prevent and delay some of the secondary complications that arise because of the primary muscular dystrophy. And within the constraints of your dystrophy, try and still maximize your functional abilities and try and improve or maintain your quality of life. So those are, in general, the goals of physical therapy. Now, people ask me, can you show me an exercise that I can do for FSH? I mean, I get emails all the time, as June well knows, from all over the world. And people will say, can you point me to an exercise? And unfortunately, my response always is, I really cannot. I cannot until I have the opportunity to see you, examine you, see what your physical abilities are, what your goals are, what is it that you want to do, what is most important to you. I mean, we could ask that question of each one of you here, and each one of you here has different abilities and different problems. And there's no one packed physical therapy program that I can give you. Just as Dr. Pearl mentioned, how she needs to look at exactly where each person is before she decides on a surgical decision, or even whether surgery is appropriate for them. Same holds for physical therapy. And this is why I cannot stress enough that really what you want is an individualized plan based on your individual needs. And this plan can be very different for each person. For someone, it may be about the appropriate activities and exercises. For someone, it may be about appropriate management of pain or fatigue. For someone else, it might be about, is there an orthosis for my foot drop? Is there some kind of a device that will help me get up from a chair more easily? Help me walk more safely. So depending on the individual needs, we will try and work with you. Now, we all know the benefits of physical activity, right? There are oodles and oodles of publications, and we know that in general, it helps control weight, reduces risk of cardiovascular disease, reduces risk of diabetes, some types of cancers, helps strengthen our bones and muscles, has an impact on our mental health and mood, and improves your ability to do daily activities and increases your chance of living longer.